patients are afraid. That's what we forget. We send these patients home with IV catheters, and this is their lifeline, and it also can be a real source of infection, and patients really are fearful, and to provide them a product that reduces that level of fear also helps them as well. Keep the dressing clean, dry, and intact, but no one really ever tells people how to do that. We can keep it clean, right? We don't get it dirty. We can keep it intact by not pulling on the dressing, but the hard part is teaching people how to keep it dry, because it's real simple. If you're in the hospital environment, when you go home to your own shower, or maybe you don't have a detached shower head or anything of that nature, it's hard. If it gets wet, you have a higher risk of infection, which you may be on your medicine longer, and everybody's ready to be done with therapy typically. We have used several tools to teach patients or help patients keep their dressing dry. We have used items from saran wrap to getting I've heard garbage bags cut out and taped. We've used Ziploc baggies where you cut the end off, you take both sides of that. We've become very innovative in how to keep that dressing dry. The thing is, patients have problems with that. Taping is bad on the skin, and it still can get through, and the dressing still gets wet. Patients who are home alone, do not have a caregiver in the home setting to help take care of their IV, is they do have difficulty with keeping their dressing dry if they're having to use a homemade product. If they're having to wrap and tape, not get the tape on the dressing and wrap it correctly with one hand, has been very difficult for them. Saran wrap is made to go protect food. It's not made to go around your arm and keep it dry. And you can't really stand behind it and say, this will work for you and keep you free of infection, because that's not what it was made for. If we have a product like AquaGuard that we can introduce to patients and caregivers and nurses, that you have a product that will follow through with the how to do that. Here's an option, here's what you can use to keep your dressing dry. It at least needs to be discussed that there is a product made specifically for that. I think a lot of patients and nurses have no idea sometimes there's a product that's made for that. We found that with the AquaGuard glove, it's very user-friendly for a person to be independent. Even if you don't live home alone, how many people want their spouse or loved one to help them get ready for a shower? So the fact that they can go in and shower when they're ready and be able to use a product on their own gives them independence and confidence to take care of themselves, and they're happier and more satisfied with that. And the glove has the ability of the patient to single-handedly apply a product that will keep their dressing dry. That's what home care is about. It's about getting patients home in their own environment, providing them a way to get better, the medicine to get better, but able to get back into their normal routine as best they can.